Hello, welcome to our webinar on nutrition and hydration in COVID-19. This webinar has been developed by a group of dietitians across the Trust and will be presented by Adele, my colleague, and myself, I'm Gemma. So we decided to pre-record this so that it can just be made available for whenever you've got a chance to watch it. If you have any questions at all, we've left contacts for different dietitians at the end of the webinar, so feel free to get in touch. So today we're going to be covering the background to COVID-19 and nutrition, so what we know so far in, I guess, still the early stages of having this around, and the European and national response to this, so what guidelines have been formed based on what we know. We're going to go over the Trust dietetic response to these guidelines and how we can work together as an MDT to produce the best outcomes in our service users. And also look at keeping you nutritionally well at work and taking a focus on nutrition and hydration in staff across different sites. And we'll finish by looking at the barriers and concerns which commonly come up, which we've seen across the pandemic. So symptomatic COVID-19 positive individuals are at higher risk of malnutrition. So we define malnutrition as over or under nutrition, and it's basically where someone's not getting optimal nutrition for their body's needs. So symptomatic COVID-19 positive patients are at higher risk due to often requiring higher energy and protein needs in their diet in order to recover from the illness. They also may be less likely to meet their nutritional requirements due to the symptoms they experience, like the breathlessness, the fever, the fatigue that we're seeing, because that can impact on appetite and dietary intake. Also, because service users are often hospitalised for a bit longer if they then contract COVID-19 in one of our sites, this can lead to muscle wastage, higher rates of inactivity, which all contributes towards the risk of malnutrition. Individuals who are malnourished have poorer outcomes and higher mortality risk from COVID-19. But also, there are other nutritional problems which can arise due to COVID-19 and the impacts of it on other chronic diseases, which a lot of our service users may have. So it's not just malnourishment, but also, for example, COVID-19 in a diabetic can have a significant impact on the service user's ability to manage their blood sugars and can cause hyperglycemia. And this in itself can warrant the need for nutritional intervention alongside medical management. So there's a whole host of different nutritional complications which can arise if someone has other comorbidities underlying. So what we've seen so far is that if a service user is older or has comorbidities, they are at higher risk of complications from COVID. So this kind of highlights why it's so important, especially in our trust. We've got a lot of the vulnerable population under our care. So, for example, an older service user at the Mount who's lost a significant amount of weight, or, for example, a service user at the Becklin Centre who has diabetes and COPD. These are both examples of service users who are at higher risk of getting those complications and having nutritional complications as well. So we know nutritional assessment and treatment are effective in reducing complications and improving outcomes. So although there's limited research regarding COVID and nutrition so far, as we're still in the early stages of the pandemic, we know from other guidelines and evidence with treating other conditions that nutrition has a really important role to play in assessment and treatment of these conditions. And also expert opinion has been used in the forming of these guidelines that I'm going to just go on to next. So they're the ESPEN guidelines, which are the European Society for Clinical Nutrition and Metabolism. So these are the guidelines for kind of across Europe regarding nutritional management of those with COVID-19. And we've just summarised the key messages here. So one of the key parts of this is early identification and treatment of malnutrition, or those at risk of malnutrition, really important. So here we're saying that regular weighing and using the trust validated nutrition screening tool is really important in line with trust policy, and repeating this regularly as well, so that we can identify early on if someone does have some nutritional needs which need to have some intervention to help. The validated nutrition screening tool is used across all of our sites, in patients, and also in the community. Those with malnutrition should optimise their nutritional status and receive vitamin and mineral supplementation where indicated. So dietetic counselling, either face-to-face, or we're frequently seeing designing interventions for service users over the phone with them at the moment, due to reducing face-to-face contact where possible. Here we're trying to optimise nutritional status in an individualised way to meet that service user's nutritional needs. So as I was saying earlier, they may have higher requirements, so we need to put things in place to meet these requirements. Maintenance of regular physical activity is really important, and if this is absent, it can have impacts on our muscle mass, immunity, our risk of other comorbidities and weight gain. Food first interventions are recommended by ESPEN. So when we say food first, we mean things like advising a service user eats little and often, fortifying meals, having nourishing drinks in order to meet these raised requirements. However, if they're not able to meet their nutritional requirements through food alone, this is where oral nutrition supplements may be required, but these should be prescribed by a dietitian following assessment. And we've also included here the guidance about enteral nutrition and intensive care. Even though this doesn't apply to our trust sites, we may be working with service users who have been into intensive care. So enteral nutrition, we mean, for example, NG feeding would be started if a service user is intubated at LTHT, and it's just important to note that ventilation and going through all these procedures in hospital, if they're really unwell, can cause long-lasting effects on physical health and nutritional status. For example, can increase risk of dysphagia and swallowing difficulties. So these are all really important to note. And overall, ESPEN highlights how nutrition is really, really important in rehab and recovery post-COVID. So we've just included this summary here of the ESPEN guidance. But as I said before, really the key parts for our trust are stages 1 to 5, going over the early identification of malnutrition, optimisation of nutritional status, and starting vitamins and minerals or nutritional supplements where indicated following dietetics assessment. Stages 6 to 9 are more relevant for LTHT if someone is more acutely unwell physically, but then stage 10 highlights over the risks with dysphagia and long-term impacts on nutritional status and physical health after COVID. So national response to COVID-19. So moving on from the European guidance, The national response, so British Dietetic Association has released a green, amber, red malnutrition pathway. So this sets out recommendations for service users dependent on their symptoms, their malnutrition risk and risk of complications from COVID-19. So starting off with green, so this is for all individuals who are asymptomatic or recovering well from COVID, or they may have not had COVID, but overall, this guidance is there to help with optimising nutritional status, good health, strength, immunity, reducing the risk of unwanted weight gain or maintenance of high BMI, which could otherwise increase risk of complications in COVID. So overall, we're recommending eating a balance of the different food groups. So where we say food groups, we mean protein, carbohydrate, dairy, fruit and vegetables, fats and oils, and overall these will help to meet an individual's protein, vitamin, mineral requirements. Eating regularly, including having snacks in between meals, drinking regularly, so aiming for at least 6 to 8 cups a day. But obviously that's dependent on level of activity and weather, impacting on how much someone's sweating. But overall, we'd say that is a recommendation. And aiming to be active for at least 30 minutes each day. So here we'd say, you know, if it's a sunny day, trying to get out in the sun to help with producing vitamin D as well, which Adele will go over a bit more later on. So amber, so the British Dietetic Association has stated for amber, this is for symptomatic individuals with a poor appetite or recent unintentional weight loss, and those at risk of malnutrition. So here where we're starting to see service users with symptoms, where we need to kind of look at what symptoms they're suffering from and how we can overcome them to ensure they're still meeting the nutritional needs. So for example, if they had a dry mouth as a result of having COVID, having plenty of fluids, adding extra sauces to meals, having more soups and stews, or even like gargling more frequently. If they are suffering from shortness of breath, they might benefit from a little and often approach, so having smaller meals more frequently across the day. And if this is the case, maybe trying to encourage fortifying those meals with higher calorie protein foods, like adding cream, butter, cheese to the meals, so that they're still meeting the higher calorie requirement even though it's a smaller meal. A lot of individuals suffer from taste and smell changes, so in order to help with this, we'd recommend maybe trying stronger flavoured foods, so adding things like chilli, garlic, ginger, herbs and spices. Some individuals might find colder foods better to manage if they're suffering from these taste changes. And overall, using these food first approaches, but if an individual struggling with their eating from each food group, not having enough fruit and vegetables, considering a multivitamin and mineral supplement, and taking a vitamin D supplement as well is also recommended. But as I mentioned, Adele will go over the vitamin D guidance for our trust in a bit. Aiming to continue gentle exercise where possible, but obviously this is dependent on their symptoms. And then that takes us on to red. So for individuals who are or have been very unwell with COVID, poor appetite, recent unintentional weight loss, and with pre-existing malnutrition, so these are higher risk patients, all of the AMBER recommendations stand, so all the food first techniques, regular weight monitoring, but in addition they may require oral nutrition supplements prescribed by a dietitian. So when we say nutrition supplements, we're referring to things like Frisibin or Fortisip, which you may have heard of. So these are fortified with lots of vitamins and minerals and protein to make it easier for someone to meet their nutritional needs if they're off the food or if they have much higher requirements.
So thank you, Gemma. So I'm going to take over now and talk a little bit about what our responses as a trust has been. So Gemma's given you a good overview of what some of the European guidelines were, the British, some of the British guidelines from the VDA. But I wanted to talk through what we had done as a trust. So I guess initially we did focus on inpatient services. At the early stages of COVID, this is where we were seeing a lot of cases and where some of the service users may have had higher nutritional needs. So with that, we had the redeployment of dietitians that I'll talk through. We developed some nutrition and hydration policies across the inpatient services to assist during that time. We also created some community support leaflets and discharge packs so people will still be able to get reliable information. And like Gemma said, I'm going to touch on vitamin D guidance. And I guess also with our response, we developed this nutrition and hydration webinar. So within our trust, we have a number of dietitians that cover a large range of services within our trust. So we cover CAM services, adult mental health, older person's mental health, forensic, eating disorder, perinatal, NICPM, and learning disabilities. So as dietitians, we're often quite a small team, and we do find that we are at full services quite thinly spread across many different fields. So in terms of that being a challenge with COVID, with our inpatient dietetics, we did have to ensure that all of the positions were fully filled. And we also had some of the community dietitians redeployed to help assist in the inpatient setting. So as part of that, all service users were monitored who tested positive to COVID. So regardless of whether they were referred to dietetics or on the caseload, we were still monitoring them in the background, which could help to capture any nutritional risk earlier on, because we have learnt with COVID, having early intervention for somebody who's at risk of malnutrition can potentially help to improve their outcomes of recovering from COVID. So again, with that, the risk of community dietitians being redeployed is that they had to reduce their caseloads quite a lot, RAG rate all of their caseload, and work much more flexibly within their team. Another thing the community dietitians have been working on was developing some online nutrition training for staff. So usually that would have been something that was delivered face-to-face. However, with how things are working at the moment, still being able to provide nutrition information for our staff is really important. So coming up with ways that we can still deliver that information to everyone. So we did develop some nutrition and hydration guidelines during COVID. So these were actually developed quite early in the stages of lockdown. So although they're probably not as used quite frequently now as they were at the beginning of lockdown, they are still quite a useful tool. So I think one of the key things is to remember, if we can think back to what it was actually like in the first few stages of lockdown. So these guidelines were developed sort of late March, early April. And during that time, there was a lot of uncertainty. There was also quite a heightened anxiety period. There was a lot of staff that were being redeployed from community services to assist in inpatient settings, which they may not be familiar with. So the way we designed these guidelines was to try and format in a way that would be just a quick reference guide. So we came up with a 2-page summary and then a 3rd page that just had a list of appendices. So that way, thinking if there were new staff arriving on a ward that were overwhelmed, there was lots of different staff changes, everything was a little bit different, that way they could use this tool as a really quick reference guide. And then if they needed further information to seek that later on when they had a bit more time. So the goals of the nutrition and hydration guideline were to acknowledge and identify the nutritional risks with COVID-19, to provide staff with a reference for nutritional management of COVID. So like we were saying, dietitians, we are built within a lot of the teams. However, we can be quite thinly spread. So this way it was a way of us relying on our multidisciplinary teams to initiate some of those nutritional practices prior to a referral to dietetics. And it was also to help capture those at nutritional risk early on, so we can provide intervention sooner rather than later. So this is an example of the nutrition and hydration for COVID guidelines that was designed for the Mount. So we created the one for the Mount and then adapted it to suit adult mental health services as well. So as you can see, it's quite a quick at a glance. You'll easily be able to find some immediate information about some of the key nutritional risks and things to monitor during COVID. Like I said, we then had a third page and a whole list of appendices which staff could go to if they needed to look at something in a bit more detail. So with the nutrition and hydration guidelines, in thinking of how staff can help us, one of the things we recommended was for the staff to be completing the nutritional screening tool weekly. So in our inpatient setting, this is something that's done as part of the admission process. And the NST, the nutrition screening tool, is something that will flag someone who's at nutritional risk and will prompt staff to create a referral to dietetics. So usually it's only done, I think, about once a month in an inpatient setting, plus on admission. So this way we requested it to be completed weekly, because within that nutritional screening tool, it needs to have updated weights, and it can also identify changes in someone's nutritional status, which again will prompt a referral to dietetics. So essentially we utilised tools that were available to staff already and that were a normal part of the process, and just tried to adapt that on how it could help us as dietitians. Within the guide, we also requested staff on the wards to complete food and fluid charts for all service users that tested positive. Again, that was another way to capture any changes in nutritional status. As we know, some of the symptoms of COVID are things like changes in taste and smell, and changes in appetite as well. And I do appreciate all the staff that are completing these forms for us, because I know they can be quite arduous, but they really do form a very core part of a dietitian's assessment. So we really do appreciate all the hard work that goes into completing those forms. They are one of the most useful tools for us dietitians. Also with these guidelines, there was a lot of input from the speech and swallowing team. So for me, I work at the Mount, and we do have quite a lot of service users that can develop swallowing difficulties. So it was a really important part of our process to be able to also monitor and identify the signs of swallowing difficulties and flag that with the speech and language therapy team. So again, we created some nutritional goals for those that were testing positive to COVID-19. So when we created these, we lined them up so they were similar to the BDA, British Dietetic Association guidelines that Gemma had mentioned before. So this slide represents the sort of green one, but more of an inpatient setting. So again, just maintaining that regular oral intake is really important for those testing positive that might not have many symptoms. So that's usually having about 3 main meals a day and having additional snacks if desired. Also ensuring that meals are made up of carbohydrates, proteins, fruits and vegetables. The carbohydrates are our body's main source of energy, main source of fuel, and protein is really important to help boost the immune system. It also really helps during repair and recovery, so when someone's quite poorly, to help with that recovery and rehabilitation period. In terms of those who were testing positive that had more high risk or were quite symptomatic, so fitting more into that amber or red category, our recommendations were, particularly at the Mount, were to have a high energy, high protein diet. So again, giving our bodies enough fuel to help energize us, and giving our body enough protein to help with that repair and recovery process. If a service user was having quite a low appetite, it's really important to maybe try and focus on more 5 or 6 smaller meals across the day. It can be quite overwhelming for, if you haven't got much of an appetite, to be served a huge, large portion, and to think you've got to get through all of that, it can be more off-putting. So having that small, consistent intake across the day can help with that poor appetite. We also recommended that the snacks that were offered, again, were high protein, high energy snacks. So a lot of them dairy-based snacks, so things like yogurts, custards, milk, but also having meat or cheese-based sandwiches. Gemma's already discussed a lot about food first and food fortification. So in terms of that, it's taking what the service user is already able to eat and adding extra nutrition without adding any extra quantity. So that could be things like adding extra cheese, margarine, or cream to some meals. And again, if indicated, oral nutrition supplementation, so the nutrition drinks such as Fresivin and Fortisip could be really helpful in this setting. So within our LYPFT nutrition policy, particularly in the inpatient settings, our recommendations are that these should be prescribed by the dietitian, as we are the nutrition experts, and there is quite a vast range of supplements as well. So it's about working with the service user and what can suit them best to help increase compliance. So that was mostly in the inpatient setting. So when this webinar was first developed, it was quite early on in the COVID period. So the focus was on inpatient. Since then, I guess a lot of the focus has now shifted to community services and supporting those that are in the community. So as Gemma's already mentioned, some of the common symptoms of COVID include shortness of breath, fatigue, loss of taste and smell, a poor appetite, and unintentional weight loss and muscle wasting. So what we know now is that a lot of these symptoms from COVID can potentially have a really long-lasting effect on a person. So even if somebody's quite poorly with COVID and makes a recovery, some of these symptoms or some of the impacts of these symptoms can potentially carry on for quite a significant amount of time. So this is where we need to really consider the community teams and how we can support our service users in the community. Again, that rehabilitation stage, so making sure we're getting enough protein and energy in that time. So even if we're feeling a lot better, our bodies might still be recovering. So I've just got a little table in here that sort of summarise what some of the risks of those symptoms from COVID might be. So again, if somebody's quite short of breath, it can actually increase their nutritional needs. The reason for that is it could just create a lot more, spend a lot more energy for someone to be breathing if it's really hard work. So that might mean their nutritional requirements are increased. And it can also cause a lot of fatigue when someone's eating as well. So some tips to help with that are going for things like softer foods, so just taking away some of that effort with meals, such as chewing tough foods. So having softer foods. Throughout this slide, we've also got some prompts to some iLearn modules. So we do have a nutritional toolbox on iLearn, and most of these are particularly pointing towards the food first, food fortification module. So you can have a look at iLearn if you're interested in learning a bit more about that. Again, some impacts of fatigue might not just be on eating, but about how we're preparing our food. So if we're feeling quite tired, fatigued, feeling quite poorly, that we might not have the energy to get up and cook a meal. So having some of those meals ready to go, ensuring that they've still got some carbohydrates in them to fuel our body. Also using pre-prepared snacks or meals, or using some meal delivery services. So that way, if it's a lot of effort to cook, you've still got something that you can just grab, and that might help to improve your nutritional intake. Again, with the loss of taste and smell, I think Gemma's already mentioned trying to increase your flavours, so having stronger flavours, lots of herbs and spices, and even sort of prompting yourself to eat, just to help with that appetite as well. In terms of the muscle loss and weight loss and muscle wastage, it is really important to note that somebody who has a high BMI is considered overweight or obese can still be malnourished and can still be at significant risk of malnutrition. So it's not all about the number on the scale, it is about the person and their nutritional status. So again, they might require food first techniques, and also food fortification, or even just recommending a healthy, balanced diet. So it really does depend on each individual for that circumstance. In terms of community, so we did develop some resources. So we developed a COVID-19 discharge nutrition pack. So it included a lot of information about the relationship between COVID and nutrition, how to base your meals around carbohydrates, proteins, fruits and vegetables, some tips on where you can find information about cooking and recipes. Again, some tips on eating with a small appetite. And I guess one of the impacts of COVID is for a lot of people may have potentially been financially. So tips on how to afford meals, or if you're struggling to get out of the house, to access supermarkets and access food. Again, we've been using the green, amber and red nutrition fact sheets from the BDA. And we have been referring to the community mental health dietetics. And there's also a Leeds malnutrition hotline if you do need further support as well. So if you have any questions about any of these resources, get in touch with the dietitian that's in your team, and they'll be able to point you in the right direction on where you can access some of these. So I just wanted to make a quick note on vitamin D. So vitamin D is something that's really important to help the function of the immune system, and it can actually help reduce the risk of developing respiratory infections. So we know with COVID, it is something that that affects the respiratory system. So those that are at most risk are people that are over the age of 65 years, those that don't have much exposure to the sun, and people with darker skin tones as well. So the current national guidance is for everyone over the age of 4 years to be supplementing 10 micrograms, which is about 400 units of vitamin D per day. In an inpatient setting, this is something that would be reviewed by the medical team. So it's an individual case, and it will depend on what a service user's blood results are and what their corresponding dosage of vitamin D would be. So there is a BDA fact sheet on vitamin D that you can look up online. And there's also an LYPFT leaflet that was developed to discuss vitamin D supplementation during the COVID period as well. And a quick note on diabetes and COVID-19. I just thought this was worth touching on because there is a lot of information out there, and sometimes it's a bit hard to process. So people with diabetes, any type of diabetes, if they become unwell with COVID, they can be at a higher risk of having hyperglycemia or high blood sugar levels when they're unwell. So the Royal College of Emergency Medicine did bring out some recommendations to stop metformin and SGLT2 inhibitors when someone's unwell with COVID. But I really just wanted to highlight that these recommendations were based on acute hospital admissions for COVID-19 and not for the general population. So it's really important that any of our service users, their medication management of diabetes needs to be reviewed by their medical team or GP. And we're not recommending anyone should stop their medications unless they've been reviewed by their medical team. I'll pass back to Gemma now.
So we've just got a slide on working together. So with regards to I suppose Adele's touched on a few of these points already, but making sure you check in with your team and dietitian which guidelines are most suitable for your work site. Dietitians are trying to be as accessible as possible, and so I'll provide a combination of face-to-face, telephone, Zoom consultations and joining Zoom MDT meetings and email support. But yeah, open communication is key. Just contacting us on email and a phone if we're not around, and we'll be happy to help. Continuing to complete the nutrition screening tool for all service users and the weekly weights as part of this, and starting the food record charts when advised, and in line with those trust-wide COVID nutrition guidance. So I was just going to touch on nutritional well-being at work. So it's really important that we as staff keep ourselves healthy, otherwise we can't be there to do our jobs as best we can. and you're just as important, your nutritional and hydration. So wearing PPE has its challenges, as we've all experienced, and it's more important, more than ever, to be keeping hydrated when on shift. So we've got the Public Health England guide there, but I'll just go over it in the next slide. So starting your shift well hydrated, so aiming to drink at least 2 to 3 large glasses before your shift, and bringing a water bottle for the commute and for the day, which you can top up. So thirst isn't the best indicator of hydration status. Aiming to drink regularly rather than waiting until you're thirsty is important, and checking the colour of your urine. So if your urine's dark, that's an indicator that you're just not drinking enough. So aiming to keep a pale straw colour in your urine, that's the guidance. Having a drink and going to the bathroom before going into PPE areas. If your work environment is causing you to sweat heavily, especially if it's a really hot day, maybe consider using a sports drink designed to replenish electrolytes, or a low-fat milk can do a similar job. So on your break or when you finish, this might help. And avoid excessive consumption of alcohol and caffeinated drinks when you're at home, because this can contribute towards dehydration. So as well as fluids, your nutritional status is really important, keeping you well, so that you can concentrate well at work, helps to keep your immune system as optimal as possible. So aiming to plan beforehand your meals when you're going to work, taking a packed lunch, and trying to aim for meals to be around 1/3 carbohydrate, 1/3 protein, 1/3 veg or salad. So carbohydrates, things like pasta, rice, potatoes, bread, protein, meats, eggs, beans, nuts, those kind of things, and then veg or salad with that, or fruit. We'd also recommend bringing some snacks so that you can have a snack between your main meals to keep you fuller for longer, aiming for the higher protein, higher fibre snacks like nuts, fruits, yogurts, and just aiming not to skip meals, because that can have a big effect on your concentration levels, fatigue, things like that. So keeping that regular supply for your body.
So we've discussed a lot of nutrition and COVID today. So it is actually a lot of information to process. So we do appreciate that you've spent the time to listen to that today. We did want to acknowledge what some of the barriers and concerns with nutrition and COVID at the moment. So we do recognise the importance of moving in line with emerging evidence and guidance, and we do acknowledge that influencing food choice and implementing nutrition policy can be quite a complex process, and it can take quite a while to become a normalised thing. So it's not our aim to create a sense of more things to do. Like I was saying with the food and fluid charts, I really do appreciate those being completed, because I know it is quite an extra task to ask staff to complete. However, it is such an important part of our assessment. So we do really, really appreciate all the extra work that sometimes this can put on our staff and our multidisciplinary teams. We do acknowledge that this COVID-19 has been really difficult on everyone and on the trust, so both in professional and personal levels. So we do understand that it is it's quite tough thing, and I think the way that our trust has dealt with it has been really quite something to commend ourselves on. So another note is that nutrition advice can be really quite heavily saturated in the media, and it can be really quite difficult to determine where to find appropriate evidence-based nutritional advice. So on this slide, we've just got a few snapshots of what some of the media headlines have been during COVID that have been related to nutrition. So nutrition is always one of those topics where there's going to be a lot of information around, and it can be really difficult to filter through and find what evidence, what information is evidence-based and where to source that information. So having a look at things like the BDA website, also looking at like SPEN guidelines. And I think one of the key things is talking to your dietitian within your team to identify, you know, even get us to point you in the right direction of what information is useful and what information might not be the best to follow. Another thing we'd like to acknowledge is that there is a lot more than just nutrition in COVID. We are just a part of, you know, a whole team. So we would like to acknowledge that, you know, there is a broad range of, you know, the MCT multidisciplinary team that is helping alongside. So, you know, allowing us to be the nutrition expert and have our input where we can, as well as working with the team, can really help to create a holistic care for our service users and for our trust to really help optimize the outcomes of our service users. In terms of our vision, so again, like we were saying, as a team of dietitians, we do recognise and understand that the world of nutrition advice is really quite heavily saturated. There's lots and lots of information out there. So we hope that by being accessible and being responsive, that positive nutrition practices can become embedded in our culture and also our trust culture, because there is a shared understanding that it does matter. So in order for us to understand this, we do want to know whether there's any ways that we can help you as dietitians, whether there's any way we can adapt our working styles to support our teams and support you even more. So in saying that, we've put our Band 7 contacts here. So if you do have any questions or any feedback for us, these are the best people to get in touch with. Again, you know, we like being open and welcoming dietitians. So please get in touch with us if you'd like any more information about anything we've talked about today, or to point you in the direction of any of the resources that we've discussed today as well. I've just got a couple of slides on a few places that you can have a look at for some useful resources. So having a look at the BDA website is a good place to start. There's also some malnutrition pathway sites. And then again, looking at the BDA and SPEN guidance. So that concludes our webinar for today. And like I was saying, please get in touch with us if you do have any questions, or if you would like any further information about nutrition and COVID at this time. So thank you.